Hi, I'm Dr. Andrew Koenigsberg of Gallery 57 Dental. Welcome to Floss Talk, where we discuss oral and dental health issues with healthcare experts. Today, I'd like to welcome Dr. Camilla Mager, a clinical psychologist in New York City. Camilla, what is dental anxiety?
So basically, dental anxiety is a fear of going to the dentist, whether it's making the appointment or actually showing up for it. We know that about 9 to 20% of Americans experience some form of dental anxiety. Some of the ways it can manifest are not coming in at all, making an appointment, then canceling it or avoiding it or prolonging it. It can be a direct fear of the pain that people are imagining they're going to experience. It can be a fear of the intimacy between patient and doctor when you're sitting in the chair and someone has their hands in your mouth. Or it can also be a fear of the loss of control that people feel they're experiencing. And frequently people who have this kind of anxiety the night before an appointment will have difficulty sleeping, will have nightmares, they may cancel the appointment, they may just no show to the appointment, they may get incredibly tearful once they make it into the office, they may feel panicked and so anxious they're having a hard time breathing.
Well, I've certainly had any number of cases where people sat down in the chair and cried before I even said hello.
It can be incredibly anxiety-provoking for people who have this fear, and very difficult and emotionally overwhelming for them to even make it into your chair.
What are some of the things that patients and dentists can do to control or reduce the anxiety?
So there are some things that patients and doctors can do together, and then there are some things that patients can do on their own. Dentists really can foster open communication with the patients, inquire about the emotional experience that the patient is going through, come up with perhaps a signal when the patient's feeling overwhelmed, raising their hand or something, the signal that the dentist needs to stop, take a break, back off. If you have a dentist who isn't facilitating communication or isn't open to that kind of work, you may want to consider switching dentists. In terms of the work that a patient can do on their own, one of the first things I would recommend is really recognizing that going to the dentist is a choice. I can choose to not go to the dentist and be in poor health, or I can choose to address my fears, learn some coping mechanisms, and take care of my body and make that appointment with the dentist. Step 2 would involve really acknowledging the fear. What specifically are you afraid of? Often just naming what we're afraid of can help lessen the impact of how frightening something is. From there, you want to identify the nature of the thought that you're having. So are you making a negative prediction about what's going to happen when you go to the dentist? Well, if so, do you really believe you can predict the future? And can you work with yourself to challenge some of the thoughts that you're having that are predictive? Step 2 would involve really acknowledging the fear. What specifically are you afraid of? Are you afraid of the pain? Are you afraid of the interaction? Do you not like your dentist? What specifically is going on? And once you can identify that, then you can begin to employ some coping strategies. Often just naming what we're afraid of can help lessen the impact of how frightening something is. From there, you want to identify the nature of the thought that you're having. So are you making a negative prediction about what's going to happen when you go to the dentist? Well, if so, do you really believe you can predict the future? And can you work with yourself to challenge some of the thoughts that you're having that are predictive?
Camilla, what are some of the things that a patient can do if they start to feel anxious during the dental appointment?
Rehearsal and anticipation are really key. It's helpful if you come up with a brave thought, something like, I can do it, I'm going to make it through this, and repeat it to yourself and practice it over and over before you even get to the dentist's office. Once you're in the dentist's office, repeating that phrase to yourself is very helpful. You can use other soothing and calming techniques like counting, meditation, progressive relaxation, and if you're unfamiliar with any of these practices, there are some great apps out there. One's called Buddhify, another's called Headspace, that can help guide you through meditation. Though I advise you practice it before you come into the office, as being primed with anxiety is going to make it very hard to concentrate that first time. So it's really important that you've rehearsed some of these relaxation techniques before you ever get to the dentist.
That's great. That's very useful because in general, patients who are going to be anxious have been anxious before and know that, so preparing in advance is excellent.
The last thing I would recommend is if you've tried all of these techniques, you've tried the relaxation, you've tried the brave thought, you've tried anticipating what you're afraid of and really challenging that idea, and none of it's working and you really need to get yourself into the dentist, it might be worth talking to your dentist or to your